Hello, good evening to everyone, wherever you are in the world. Thank you very much for joining me on another one of these interviews where I get a chance to explore the experience of people who have been trying to raise awareness, bringing challenges to the COVID-19 pandemic. For anyone who has been in that role of asking questions, they will realize that it oftentimes is not appreciated. But there is still a responsibility to ask questions. There is still a need for challenge because that's what science is about. Science isn't just about following a consensus. It's only when science can answer challenge that you understand that the science that you're following actually makes sense and is robust. So, part of the interview today is with Sam Brokken, who was a very vocal voice in Belgium, and he went through the challenge of questioning the experts. So, I'm very interested to hear his story and to understand what cost it comes with for those who are willing to speak up. So, let's bring Sam into the picture here. Sam, how are you today?
Fine, thank you, Philip, for inviting me.
Wonderful. So the first thing I want you to do, Sam, is I want you to introduce yourself so that we know a little bit more about you. Oh, go ahead.
There was there
Yeah,
was
go
some
on.
some kind of a glitch on the line, but I guess you're trying
It's-
to ask
it-
me to
As to
introduce my.
introduce yourself. Yes, that's right. Yes, go ahead. Go ahead, Sam.
Um, yeah, well, so I'm Sam Brokken. I used to be a physiotherapist in Belgium. Had a private practice for over 16 years and specialized in manual therapy. Studied on later to become an osteopath. And eventually in 2016, I felt that the biomedical model was feeling a bit too limited. I encountered a lot of dependency of patients towards the healthcare system, and I found it strange to believe that it was so difficult for a lot of patients to take back control of their own health. If I prescribed them exercises, they didn't do it. They wanted quick fixes, and I was like, why are so many people dependent on healthcare and don't take control of their own lives? And then I went to the UK, and I wanted to broaden up my perspective and started studying public health, health promotion, and epidemiology. And yeah, that sums up my the start of my lecturing career a few years ago. Yeah.
Excellent, excellent. So, in terms of your position, because where you suddenly stepped into the forefront and the limelight was when you decided to engage with the government in Belgium with regards to COVID pandemic. But what I'm curious about, Sam, is I oftentimes want to understand what triggered you in the first place. What was it about you and your background that made you even want to engage in that kind of way?
Well, I think it has to do with my family background. I was raised in a political nest, so I had a lot of family who were acquainted and also active in the political midst in Belgium, also on an international level. So I was used to hearing politicians at the coffee table talking with my grandparents on issues, and high-ranked civil servants coming over the floor. And I was like, at an early age, I already understood that there was a difference between the reality we see as a population and what goes on behind the scenes. So when the COVID broke out, let's say in February, March, I started questioning a lot. And the first data I saw made me feel very uncomfortable. We had these airplanes, we had a few cruise ships, um, and what we saw there was that basically everyone got infected, but there was hardly any mortality to be seen in these airplanes or cruise ships where people were locked together for weeks even. And So the fear mongering, in contrast to what we saw in the real world, didn't add up. And that made me worry. And then I thought I have to keep following this and keep track of this, because here are things at play that don't make any sense.
You raise an important point there, Sam, is that when I started my research as well, when we were looking at COVID, because I was fascinated to try and understand the science. And one of the things that had stood out to me very early when I looked at the Chinese data was that there weren't any children who were sick. It was primarily adults. And the majority had comorbidities, and the most common comorbidity was hypertension. And I knew straight away that this didn't follow the normal pattern. And I was concerned that there wasn't enough understanding of the science to direct carefully as to what we should do. Did you find that the science got sidelined, or the questioning, once there was an agenda, once the agenda kicked in, that questions were no longer appropriate?
Yeah, and that made the situation even more worrisome. Then we're talking about the end of March 2020, when the narrative of all governments at the same time changed. Up until then, most governments or experts stated, look, face masks don't really contribute um, to diminishing the spread of the virus. You just have to keep washing your hands, take some basic steps to prevent transmission. And that all made sense at that point in time, until the end of March 2020, when all the governments at the same time changed their narratives, and suddenly it became something of an extremely dead virus. Suddenly face masks were mandatory. And I was like, what is happening here? And that went on up until, let's say, May, June 2020, when the first peer-reviewed articles appeared, and from different continents. And they had a prediction of about 0.5, 0.7% mortality, which makes sense. But in the meantime, I also understood, with a bit of the background I have in epidemiology, that you're just in the beginning of the testing. And at that point in time, they started testing massively. So the denominator in the equation becomes larger, which means that the infection fatality rate that was considered to be between 0.5, 0.7 in mid-2020, that would decline, because the more people you test, the larger your denominator becomes. So, and that's something we have seen throughout all epidemiological data in the past. In the beginning, an IFR is always very high. And that diminishes through time the more you test. And so I already knew back then all these measures are disproportionate. So during the summer of 2020, I started gathering as much data as I could. And I wanted to propose an alternative for all these strict lockdowns, let's say all the measures that were totally disproportionate, like school closings, factory closings, travel restrictions. You weren't allowed to leave the house after 12 at night. It was like, what does the virus, do after 12? Does it become even more aggressive after 12 o'clock that we are? So the measures didn't make any sense.
So,
So I
just
started.
holding your point there, Sam.
Mm.
Based on your experience with politics, what was going through your head? Because you would have interacted with those political minds. This is what I'm curious about now. What were you thinking?
Well, I wasn't the only one thinking what I'm not now going to state. I think I can say this, but Professor Matthias de Smet, who is also a big name internationally now, and Professor Lieven Annemans, those and myself, we were communicating since March 2020 with each other. And we already knew that there was a hidden agenda at play. That was one of our, let's say, first thoughts we had end of March 2020. Here are things at play that we cannot even talk about now, because if we do so, we'll be considered conspiracy theorists. So what we decided to do was that Matthias Smet was focusing on the psychological impact on the population and keep it in a science manner of communication. The same thing I did was tackling, let's say, all the mortality data, and Professor Lieven Annemans was communicating about how important it was to keep the well-being balanced out during all the disproportionate measures. But behind the scenes, we were talking about all these politics at play. And we also dived into the data of the WHO. And that was something remarkable, because up until then, we were all like also we found the WHO trustworthy, and being a lecturer myself and a head of research at 2 university colleges, I was used to, taking the WHO for granted. And mid-2020, we took a dive into the website, and we saw the list of funding, of the funding list of WHO, and we were totally flabbergasted of what we found there. It was like, and they just openly communicated it as well. It was so. There was the phase that Donald Trump left the WHO, and we immediately saw the data change on the WHO website. So Bill Gates suddenly was the number 1 sponsor, and the Gavi Alliance was on number 4, and the Bill and Melinda Gates Foundation was on number 2 as a funder. So basically, there were already in the top 4, 3 of the vehicles of Bill Gates sponsoring the WHO. And then we started looking on the internet and found out that he bought stocks at BioNTech, and we were like, this can't all be a coincidence. And we couldn't talk about this. We didn't dare even to communicate this in the press or the mainstream media. These were things we were talking about behind the scenes. And we kept communicating on what we did have on data, on science-based information. And that was our way of trying to evoke some reaction and response in general public, as well as within the political sphere. Look at the data, ladies and gentlemen, in Parliament, because it doesn't add up to what you are proposing to do.
So just to pull into this now. So this led you to then submit a statement to your government suggesting that, how did you describe it? What were you saying to the government based on the data at that time?
Well, I published an open letter to the government in Belgium and to the EU on August 24, 2020. And what I described it as a reversed lockdown, which is basically the same as the focus protection that 3 months later was being published by through the Great Barrington Declaration. So it was the same thing. It was like, we have the data. We see in the data that we have that the mortality rates are higher above 60 and with underlying diseases or comorbidities. So I was like, why not release the healthy young population, let them circulate so that everyone can get infected, because the mortality data were already clear that these weren't the vulnerable groups. And these people would initially catch the virus, have a good natural immune response, which would prevent big outbreaks in a later stage. And if you could, I don't want to say isolate the elderly and the people with comorbidities, but at least inform them correctly about the risk health they have, then it's up to them to decide if they want to circulate within the younger spheres as well, or that they want to keep themselves isolated. That had to be a personal choice. That's what I proposed.
Can
And
I
I,
can I ask you a question on that? I'm reflecting now as I remember my thoughts at that time. I had a similar thing with regards to allowing the younger people to be exposed to the virus, but I realized the problem is that when I had looked at the data as well, even though it was a small fraction who were could die from severe disease because of, say, interferon autoantibodies, which we didn't know at the time, I was thinking to myself, once the first few get severe disease and die, would the public then panic and go into lockdown anyway? Thoughts on that?
well, I've thought about this, and I used to make a comparison with influenza,
Mm.
and they always shot me for it, and they said you can't compare the two. But the thing is, um, we never took any measures during influenza epidemics. And I still remember that I went to elderly care homes where my elderly family was, and I visited them with my small children who had a running nose and probably had some flu, but nobody tested them. So what happened, also the data from influenza, and I think it's an important one to discuss, is the fact that officially, let's say 650,000 persons a year die from influenza. But this is a huge underestimation because there was never profoundly tested on a huge scale like they did with COVID.
Hmm.
Every person that dies in an elderly care home has been written away as a natural death in the last few decades. I don't think there are physicians, and I know you have a lot of experience in geriatry. I don't think physicians with somebody who is deceased is going to take a nasal swab to check if this person has died from influenza or an adenovirus or whatever, or a rhinovirus. It was never tested.
Absolutely true.
So,
Yes. Hmm.
so probably we lose 1.5 to 2 million people a year on influenza, not 650,000. These are just test samples in a sample size, but most of them are not even known or noted as deceased based on a potential infection of a virus. So we probably have lost, since the Spanish flu 1918 up until now, every year we probably have lost 1.5 to 2 million people on influenza, and there was never any measures being taken. So why all of the sudden we had to do this with COVID? It didn't make any sense. So
Hmm.
that's when we knew there was another agenda at play.
So this is fascinating stuff, and because it's difficult to talk about the conspiracies, so to speak, because immediately you're right, you lose the scientific audience, which is important to keep on board. So we'll hold that thought, and we're going to follow along with after you did your statement to the government, you then went. This is in now 2021 to challenge the consensus from the government in Belgium about their approach to the pandemic. What was it that happened there?
Well, I have to go back to the letter for a second because it was co-signed by 1,500 medical doctors, health professors, professors of medicine, no one from the general public, scientists. So this was a huge letter. It had a huge impact in the public space. Since then, I was silenced in the media. So it was very strange for me to suddenly receive a phone call Don't forget, my open letter was published August 24, 2020. So I was silenced up until February 21, when I suddenly received a phone call from the national TV broadcaster. Would you like to join into a national live TV debate with a state-appointed expert? And I was like, why now? You kept me silent for so long, and I wasn't allowed to talk anymore publicly. But I said, I'll do it. And so what happened was there was a TV debate Sunday morning, 14th of February, Valentine's Day, 21. And we were normally, it was foreseen that we had 20 minutes of debate, but we didn't make it so far. So suddenly the state-appointed expert showed some kind of paper, and he waved with it before the camera, and he said, we have the absolute proof that vaccines will stop the transmission. Don't forget, the first vaccines were deployed in Israel, I think December 12th, 2020. And then they started distributing the batches around the world. So February 21, they still had to start with the full-fledged vaccination campaign in Belgium, where I come from. So we said, we already have the proof that I was doubting this during the debate. I said, you will not be able to stop transmission with a vaccine because we have a mutating virus. So every vaccine will always be leaky, per definition. And I have the proof, he said, I have the proof that transmissions will be stopped from Israeli data. I said, I want to see that proof. Of course, there was no proof. So I stated three things. I said, first of all, it's of no use vaccinating a population under 60 without comorbidities, because the virus doesn't kill these people. The second thing I stated was that QR codes, or back then it was still called by the European Commission the Green Pass, so which eventually became the COVID safe ticket. I said it's of no use implementing this, because this implies that the people who got a vaccine, they still have the potential to get infected, and they can still transmit the virus. So what you're basically doing is give these people a license to infect others in a restaurant, in a bar, wherever. So all the people refusing the vaccine and need a PCR test to get into a bar, a PCR test that only remains valid for 24, 48 hours, those people most probably don't have the virus. Those are the only safe ones. The safe ones are the ones that are not being vaccinated. Yeah.
And so this is where they shut you down.
Well, I stated a third thing, that I found it totally unethical to even think about vaccinating children. And then they shut the debate down. Yeah.
What happened afterwards?
So it was a Sunday, and apparently the state-appointed experts behind my back organized another press meeting to, where the journalists could talk to the state-appointed expert on the fact that we had that debate in the morning. They didn't talk to me anymore. They just listened to the state experts. So Monday morning, every newspaper, every magazine, every radio station, every TV station was covering my comments, basically stating that I was a potential murderer, that I was a conspiracy theorist. So I had the whole bunch of maleficent words thrown at my head. Was I think, on cover of every outlet and in every media for about a week and a half, 2 weeks, that it was discussed, debated. So philosophers and sociologists were invited in studios, and they had to say they shouldn't have allowed Sam Brokken to speak, and he's not an expert because he's not a virologist. He's just a health researcher with a degree in epidemiology. So he's of no Yeah, so that's what happened. A smear campaign for about 2 weeks, and then eventually, yeah, I felt that my university colleges they were getting into trouble because yeah, everywhere their name was mentioned and linked to my head, and so for them it was bad publicity. So what eventually happened, a month later, they just fired me, and that was the end of my academic career. Yeah.
Listen, I mean, I think it's important for people to understand that when you speak, it comes with consequences. A lot of people don't accept that, especially people who are in the promoting of the narrative. They don't see that because they are following the stream. They're going with the current. If you're going against it, you have great risk. When you had that experience of losing your position at the jobs that you were doing, did you have any regrets?
Not at all,
Why?
because it was my moral and ethical duty, and I still feel the same today. You know, if this would happen again, I would do the same. I still cannot believe that so few people, few health professionals, academics spoke out, that they remained silent, although they should have known better. Um, you know, you're talking about a worldwide um, system that's being put on humanity. The, the fear mongering, the scaremongering, the way they coerced people into getting vaccinated. I saw this happening and I was like, I wouldn't be able to live with myself if I wouldn't have responded to this. And although I realized that what I did wouldn't change a lot, or at least not on an international level, because I'm coming from a small country like Belgium, you don't make a big impact internationally. That's different with the US. You know, if somebody shouts there, everybody has heard it. That's also why my focus protection letter didn't reach further than a few countries in Europe. But it was quite obvious that somebody had to step up and had to start shouting. And even if it was in the desert, look, I have children, and I was thinking, is this, if this continues, and we see this continuing, by the way, up until today. So there was a huge a turnaround in the beginning of the pandemic in March, April 2020. So then I felt this is politics at play, and now they're going to use that momentum to go even further. And that's what we see today with CBDC, digital ideas. There is some kind of a totalitarian. I'm not saying it's a conscious agenda they want to push through, but at least everything is more or less pushed in that direction. And I was thinking of my children. I was like, this is not the world I want my children to live in. A world that is being governed by a few bodies that are unelected, non-democratic, that are taking control over the global population. I think we've never seen this happening before. It's like we're in a war, but it's not with weapons. It's being fought from an intellectual perspective, through digitalization, through AI, algorithms. You get canceled on social media if you try to be a dissent voice in the story. You get silenced, you lose your job if you speak out loudly. These are things we've seen before in history, and this is not a good sign for the future. And that's one of the reasons I wanted to speak out, even if I knew I took a risk. I have to be honest, I didn't think they would fire me because internally I had some support. I have to be honest, I had some support. I think the reason they fired me finally was because of pressure from the government. And there is a journalist who claims to have found that I was basically kicked out of my chair because national politics got involved and basically stated to my university colleges, get rid of him. I cannot prove that. And there is a journalist in Belgium who has described this and put it on paper. And so then I knew I didn't do anything wrong, that I did the right thing. Otherwise, politics wouldn't have gotten involved to kick me out of my chair. So.
These are important points, Sam, and this is why I like to capture them. Because I think that in the context of where we are now, the world needs voices, needs people who are willing to ask questions. And this is an important point I emphasize to people, that I'm not afraid of challenge when I talk about, say, autoimmunity. I am very happy for somebody to challenge me because I believe I can answer all the questions. I have no concerns about it. But when you don't have the answers, or when you have an agenda, that is when there is oftentimes fear. There is something that you alluded to before when we were talking about that 80-20% in terms of the population. Could you explain that so that people understand a little bit more?
Yeah, if you look in history and you look throughout even historical science and peer-reviewed science, through every time humanity goes through a difficult period in time, is it a war or an economic downfall, or like we saw in 2008, always it appears in psychological studies that about 20% of the population see these things coming, and they have a kind of an helicopter view, and then these people see what is happening, and those are the people also revolting, or at least try to engage in debate, or at least try to make other people aware of what is going on. And the other 80% remain silent. Why? The system just makes you like this. You're being indoctrinated by the educational system. We've not been taught to, let's say, nobody teaches us how to think. They teach us what to think. And for a lot of people, they don't even realize it, that even if they have a bachelor's degree, master degree, PhD, they just go along with the flow. They don't think for themselves. They just produce what the society expects them, or the academia expects them to produce. So there is no reflection anymore. And there was a study somewhere in the 1960s. I forgot the name of the professor, but he was hired by NASA. And NASA asked him, set up a kind of a study and a framework so we can find the geniuses amongst children. Because these geniuses, if we can find them early on, when they're still young, we can also follow them, follow their career, and eventually hire them for NASA. Well, the professor started off with kids that got born, followed them with his team for 20 years. And what did he find was extraordinary. He saw that children within the age stratification from 0 to 2 years, 98% of them could be considered geniuses. But once they reached the age of 18, only 2% of them were still considered geniuses. So the conclusion...
I have to pause you there a minute. You're saying that 98% were considered geniuses?
Yes. So apparently children between 0 and 2, when they get different, 0 is probably a very, very early age. But as soon as small children get some kind of a complexity to resolve, an issue, they find creative ways of handling this, and they are open. They have an open perspective. They are capable of problem solving, and they think out of the box naturally, because we are made like that. We are able and capable of doing much more than we are allowed to by the system. And so that was a conclusion of that report as well, finally. Like, our educational system profoundly kills creativity, problem solving capacities, and ending up with only 2% of all these youngsters that you can still consider geniuses at the age of 18, and all the rest flunked along the line and were not capable anymore to comprehend difficult tasks or find decent solutions for everyday problems. So our educational system, and there's the same in health professionals, health professions, we are taught to think in a certain direction. Here is a symptom, that's a therapy. This is a symptom, here is the drug that you can use. But we never address the root causes. And that's why I'm so afraid from the WHO, because they always consider a one-size-fits-all approach, and that doesn't work at all within health sciences.
That's a really, really profound thought. And do you think this is exacerbated or minimized by social media? Do you think social media even makes it more significant that that almost mindset where people just go along? Does it get worse even for adults, even beyond the age of 18? So meaning that at 18 it's 2%, but by the time it's 30, it's 0.1%.
Don't forget, these studies were done in the 60s and the 70s, so I think it has declined extremely hard now. And we see from international data that have been published in 2023 that the IQ, intelligence quotient, has dropped down worldwide. Looking at the last PISA reports, so where they evaluate 15 years old capacities in maths, sciences, and communication, all countries throughout the globe have crushing figures now. Everything is going down the drain. And I found some studies, because I'm going to write a piece about this. I already wrote one on artificial intelligence, deep learning, and the potential impact, negative impact this will have on healthcare. But it comes down to the same thing, that's that we are losing the capacity for critical thinking, problem solving, and in healthcare, clinical diagnosis. We become vulnerable because we're so vulnerable for using protocols, frameworks, that we lose the capacity to use our own brains to come to a diagnosis. And what we see now in the latest research is that the time span, the attention time span in youngsters has declined. Philip, in our time, it was 30 minutes when we were 15 years old. So you have to imagine sitting in a classroom and lessons, the duration of one lesson was 50 minutes or 60 minutes. So back then they were already complaining that we were only capable, that our attention span wasn't larger or bigger than 30 minutes. Nowadays, I let you guess how many seconds it still is.
Seconds.
Not even minutes.
And this is 5 seconds.
So this means that students don't capture anything anymore. And how does it come? You take your mobile, and all these social media posts, what they basically are little compact messages from 5 to 15, 20 seconds max. So the youth nowadays isn't used anymore to have a time span that surpasses these 5 to 15 seconds. Because it's the only thing their brains has been trained to do, is to capture information within a time frame of 5 to 15 seconds. So everything that exceeds that time period, they don't capture anymore. So I'm very worried, and I'm going to write a piece on this, because if you look at the PISA results published by the OECD, it's terrible. It's a worldwide phenomenon. And I think my hypothesis is the fact, and my eldest is 20 years old, my son is studying at university, and he's the first generation that has been, they are born in a digital world. From day one, they were confronted with digital apparatus, a mobile phone, a screen to look at, a computer, a laptop, an iPad. This is the first generation in history that has been raised with all these digital apparatus. And I think this will have a hugely profound effect on intellectual capacity, and the potential even in the future that we might bump against the wall, because we need people that are creative, and we need people who can think critically, because those people push science ahead. But
You
what
know,
will happen if we don't have people anymore that are smart enough to change something or to create something new?
it raises that question that is bugging me when I look at the United States, where they have colleges and universities with vaccine mandates. And I am thinking to myself, what in the world? Because it's not just about the students, it's the parents. And I'm thinking, what is it that would make them not question or challenge that? It's almost frightening, because it indicates that, as you said, is the challenge that's happening where the world is going never going to have any traction because the population is unable to understand and integrate how significant some of these patterns are, these important things are.
I think a lot of it has to do with the fact, or the way our society has evolved in the last few decades. It has become more competitive. I give you an idea. In 1970s, of all wealth that was created by big corporations, 30% was redistributed in wages. Okay? Nowadays, you have to go, if you have a partner, you have to go and work with the both of you to keep paying the bills. In the 70s, you could buy a house, a car, have a family, go shopping with one wage. That's over. That's over since two decades. So the capitalistic model has pushed society into basically forcing people to have two jobs
Mm.
to keep the ball rolling. And the wealth distribution, where it used to be 30% that went back to the people working on the floor and creating the wealth, is today is 0.3%.
Really?
All the rest goes up to the big corporations, the big shareholders. So people they don't have time to think anymore. They're under constant pressure of society. Nowadays, when you're 18, you have to go to university. You're expected to get a degree. Once you have a degree, you have to meet someone. You start a relationship, you buy a house, you buy a car, you find a job to pay for all the mortgages and all the loans you have created. Then you have children. And what do you have to do? You have to put them in um, before school. You have to bring them. You have to start. Let's say it's over everywhere. It's a traffic jam. So you have to leave at 6:30 in the morning. So your kids are too early for school. So they go to a preschool. I don't know, somewhere where they gather the kids before school starts. Then they go to school. Then you have to rush after your work to go and grab your children. But normally school is finished at about 3:30, 4:30, but you have to work until 5, 6. So then you have the traffic jams again. And then you finally can catch your kids at 7 o'clock. Then you have to them to grocery shopping, bring them home, give them food, and then you're obliged by society to let your kids play or play soccer or have some activities, extracurricular activities, or playing piano or gym classes. And you have to start driving around as a parent until 10:30 in the evening. And then you come in at home and you drop dead like a fly in your sofa. So these people don't have time anymore to reflect, to think. They're basically, even if they make money, they're still basically surviving. They're trying to survive within society. And they try to be part of a society that has been enforced upon them by big corporations, consumerism, capitalism.
Yeah. You
And then
know,
you
I. Mm.
then you don't have the thinking space and capacity anymore. Even if you have 5 degrees, if you're locked up in this kind of job or lifestyle, you don't have the energy, let alone the intellectual power left in the evening to reflect on what is happening in the world.
It brings us nicely into what your vision is. And I'm going to pull it up here. Tell us about what it is you're trying to achieve here.
Well, that's a project we have been working upon since 2 years with a group of 25 uh, researchers from around the globe. And we're aiming on two things. This is one of them. This is a education. This is a program we offer on holistic science and clinical methodology. Why? Because within the group of the 20%, you have a lot of health professionals who see that it has to be done differently. Certainly during the crisis, during COVID, a lot of health professionals started realizing that our biomedical model is basically, yeah, not working. It's such a reductionistic model, hyper specialized, which leads to a lot of medical shopping because health professionals don't always have the capacity anymore because they have to work within frameworks and protocols to really address the root causes of the problems of their patients. And so they don't address they don't get to the correct diagnosis anymore. And if they do so, the treatments are often not really working. So we need a totally different approach away from what we are doing today. We're treating symptoms. And a lot of health professionals realize this and they're trying to find another way. But they have not been taught how to think in a holistic, integrative way. I haven't been told when nobody told me when I was um, uh, getting my degrees how to think outside of the box. So we've basically lost the capacity to clinically reason, and certainly in a holistic manner. It's not in my education during my period. They never taught me anything about social determinants of health or well-being. It was like, I don't know what that is. Um, if you realize that 80% of your health is being constituted by social determinants of health and not by infections, then what do we have to address?
Yeah,
The
this
social
is this is the
determinants.
this is
And there we have a total disbalance because all the money goes to curative medicine and
yes.
basically nothing goes to preventative medicine.
I think that this was shown up in the pandemic when I saw people arguing about things like vitamin D and saying it didn't work for COVID. And I was thinking to myself, whether or not it works for COVID, have you noticed that 86% of the population is vitamin D deficient? Fix the obvious things. And I mean, it's unbelievable that you can have a situation like that occurring in the scientific community where we have gone so far away from the fundamentals of physiology and pathophysiology that even obvious things, they would rather to give you a drug than to tell you that you're vitamin D deficient.
True. And that's what we're trying to address with this program. So what we did with the 25 researchers is try to find all the gaps within our biomedical model today. And these gaps we perfectly filled with this program. So what we try to do is to bring forward this program now to help doctors and physiotherapists around the globe to, we're not going to tell them what to do. We're going to help them how to think, how to implement a new way of clinical reasoning, and how to implement this in a holistic perspective that addresses the root causes of the patient's problems and not only the symptoms. And the reason why we want to do this is because I believe this is the only way that we can change the system profoundly, starting with the grassroots movement of health professionals that implement a new way of healthcare bottom up. And that's the only
Yeah.
way we will be able to fight against a system like the WHO that wants a one-size-fits-all approach, something I've never understood during Corona as well. The same approach for Africa as for Europe. And I was like, the average age in Africa is 18.7 years old. You cannot compare it with an old continent like Europe, where the average age is almost 50. But that's where biomedical modeling is heading to. Eh? It's the same with blood pressure. I always use this as an example. Blood pressure is a very nice example. The American Heart Association is considered as the guiding force behind everything that has to do with heart and cardiovascular disease. And everybody's following their advice and their protocols if it comes down to blood pressure. If you see 20 years ago, they set the benchmark on systolic pressure on 140, or like they say in Europe, 14. And so what it was, if you look at the curves, it's just a Gaussian curve. And in the middle, you had 14. But what does this say if you come to think of it profoundly? This means that if you have 100 people, one person has 14 or 140 as a systolic blood pressure. 50 of them are below and 50 are over. And they just, with a wet finger, say, because it was based on flawed data, and they said 14, that's a high blood pressure. So what happens? Drug pharma, a big pharma, just pushed on all these pills on the market, and they said everyone above 14 needs to take pills to get to 14 in the middle, and everyone who has 9 or 10 or 11 systolic blood pressure needs to take pills to get to 14. Now, 10 years ago, they suddenly changed it from 14 to 13. And I looked at the data, and the data were primarily based on studies performed in the US. Now, we all know that the US is vulnerable for screwed data if it comes to these kind of things, because most of the people there, more than half of the population, is obese. So if you're going to take them as a benchmark for the rest of the world, and then you arbitrarily say, nah, we're going to shift it from 14 to 13, then you have a huge amount of population that suddenly has theoretically a high blood pressure. And that's what we want to address with our program, with the clinical methodology, is to look beyond this. Why? What should every doctor do? Not just test your blood pressure and state, oh, you have blood pressure of 15 or 16, you need some pills to diminish it. No, what we should do is look at the genetics, family constellation, even epigenetics. It's possible within that family, if you ask for it in your anamnesis, and you take time, instead of 3, 4, 5 minutes of anamnesis, you take half an hour or an hour with your patient, that you might notice that within the family, all the siblings, mother and father, all have a high blood pressure, or what is being considered as a high blood pressure of in the range of 14, 15, 16. So this might be totally normal for them within that family. That might be their genetic imprint. So that person that comes to your practice and has an obvious 15 systolic blood pressure or 150, um, you would prescribe them a drug for what? Because it's their normal genetic imprint. And
Yeah,
that's what you get with averages in medicine. We always try to push everyone to the median.
the midpoint. Yes,
To the
you're
mid-
quite right. And what I think you're highlighting, Sam, and we're going to be wrapping up now, and I want you to think about your closing statement as to where we need to go. But you are highlighting, and I have seen this, that the COVID pandemic has pulled back the veil on medicine. And what is now being shown to the public is that the emperor has no clothes, because it has demonstrated that a lot of medicine is not about getting to the fundamentals, primary pathophysiology. Because if we had done that with COVID, we probably would have handled it very differently. A lot of people are making recommendations, and I can challenge any one of them. Explain to me the disease. Why do these people have it? No, they can't, because the primary pathophysiology hasn't been understood. And until we get that model of medicine back, where we are not satisfied, as you say, with hypertension, it's embarrassing that the medical community is still calling it essential hypertension. We need to get the fundamental primary pathophysiology to understand what is the difference. Quite as you said, we need to understand these diseases. So there is a lot of work that needs to be done, and a different way of thinking, a different way of approaching science. And it requires different kinds of people to step forward. So I find that that program there, for those who are interested, if you do register for it, you can say that you've seen it here. I think I'd appreciate that. But yes, I think that that is there for people to learn from. So
I
you,
want to add to this, if I may, Philip, very
yeah,
briefly. We only allow 20 people per academic year because all our faculty, these are all university professors that have a huge background and have been researching holistic science for a while. And we are not aware of it, but there is a bulk of peer-reviewed evidence on holistic science, but it doesn't seem to break through the glass ceiling of academia. So we only allow 20 people because we want them and us to challenge each other. If the group becomes too big, it becomes impossible. We want to learn from these people as much as they can learn from us, and has to become a kind of peer group that become ambassadors for a new medical model.
excellent, excellent, wonderful. And so, your final thought, Sam, as to what you have seen over the pandemic, where we are today, what is your word to the public?
I would invite everyone to take a step back. If one of these stories pops up again in the future, they're now currently talking about disease X. Just step back and look at it from a bit of a distance and ask yourself, has this something to do with health or something else? And I think if you just look at what has been going through the press in the last few weeks on disease X, everyone who has two brain cells already knows that something doesn't add up when they're trying to push forward a disease that doesn't even exist yet. Why are we talking about it then? So reflect, and I think everyone should use one question always. It's one word, a small word. If you get confronted with something that you find peculiar, ask why. And keep asking why until you have an answer. And as long as you don't have an answer, there's something fishy.
Excellent, excellent, and very, very wise words. Now, for those who don't know, Sam has stayed up very late because he's currently based in India to stay with us. So we really, really appreciate this information and these lessons. If you're interested, please follow up on his course. It's humaniwellacademy.org. And so, for those who are interested, certainly follow through. We do need a different model for healthcare in the future. Sam, if you could just stay with me a few minutes while we play the outro. And for everyone else listening, thank you for staying with us. Have a great evening.
Thank you.